Good evening. My name is Jennifer Purdy. I am the Green Party of Canada candidate for Canada Carleton, and I just want to take a few minutes to talk about Pharmacare. I did just do a video and it lasted 14 minutes, and I thought that's probably too long. I really just want to scratch the surface. So, a couple things about Pharmacare, because I know a report came out this year. What you may know or may not know, though, is that there's been various commissions and various reports basically ever since Medicare, or publicly funded healthcare, came out way back when. Every few years, there's a report, there's a commission, there's research done, and it's published. So sometimes it's done by the government, sometimes it's not. And it talks about Pharmacare, and it talks about what a great deal it would be economically for everybody and how we should have it. And yes, we are apparently the only industrialized nation with a publicly funded healthcare system that does not have Pharmacare. So this discussion about Pharmacare is nothing new. And there are plenty of reports that could have been dusted off, and the current government could have used that. And if it was really important to get Pharmacare implemented, why wasn't it done? Why was the process not started in 2015? Or if you're thinking, oh, they had other priorities, which they may or may not have fulfilled, then why didn't they at least order this latest study, which some might argue, I'm not too sure that it was even necessary, but why didn't they even order this latest study in 2015? So they could have gotten the report in 2016, and then, but I guess the timing wouldn't have been good, because then it wouldn't have come, the report wouldn't have been finalized in the year of the next election. Because right now, and maybe it will be in their platform, but let's think back to 2015. How many things were in the platform that have not been done? Just because, like, the first thing I'd like to say is, just because a party, and it could be any party, it could be the Green Party of Canada, just because somebody says that they're going to do something, just because they order a report to be done on something, that is signaling. That does not demonstrate intent. And the fact of the matter is that too often now, political parties will say what they will do, and they have absolutely no intention of fulfilling that promise. And we've seen it, right? So this is a sort of situation of fool me once, shame on you, fool me once, James, in accordance with what George W. Bush may or may not have said, right? But be cautious about this. Just because there has been a report on Pharmacare, and it may be in the platform of the current government, means nothing in terms of their intent. Now, why wouldn't they do it? Probably for the same reasons past governments haven't done this, because keep in mind, there have been several reports, several commissions all saying for individuals, Pharmacare is a great idea. Economically, for Canada as a nation, we would save money. It costs more money when there's this patchwork of insurance companies and benefits and that sort of thing, right? Because then you can't get mass bulk purchases that will otherwise drive down the costs of medications. So why hasn't it happened? Why don't we have Pharmacare? Because really, with all those reports, all pointed in the same direction, all saying that we should have Pharmacare, you'd think we would have had it 20 or 30 years ago, or even 4 years ago, or even 8 years ago. But the fact of the matter is that who benefits when we don't have Pharmacare? Think about it. Who benefits? And people who don't have enough money to cover the medications, I'd argue they don't benefit. Our healthcare system is already under a lot of strain, and so I'd argue that the healthcare system does not benefit. I think the healthcare system, we're at the point where we want people to be healthy and well so that they don't have to see doctors, they don't have to go to hospitals, they don't need all the referrals and consultations and visits, because it takes resources, right? Wouldn't it be lovely to have people healthy and well? But who loses money when people are healthy and well? And you might argue, doctors and nurses, not necessarily, because right now, many people will tell you there's not enough doctors to go around. Pharmaceutical companies, right? The problem with the pharmaceutical companies and Pharmacare is that the prices will be negotiated from the government, the pharmaceutical companies, and the government can drive a very hard bargain. So pharmaceutical companies stand to make a lot less, and that's where some of the savings comes in if we go to national Pharmacare. The other group that will stand to lose is the insurance companies that provide benefits. Because why would you or your employer pay benefits for for drugs if it's already covered by the government? So there are some really, really big important players, and they stand to lose. And as we've seen rich evidence over the years that, and much more recently, of course, with the SNC-Lavalin scandal, that both the Liberals and the Conservatives, they've got friends like you and me, have no power and influence. I'm sure they really like us, but their friends are the big companies and the big industries like oil and gas, pharmaceutical companies, and insurance companies. And so that's the only thing I can think of, right? It's either that or governments haven't necessarily been competent in the past, because Pharmacare is such a basic thing that since the 60s, if not 70s, we've been hearing in the various commissions reports that it would make sense financially, make sense economically to have Pharmacare, and yet we still don't have it. So it's either incompetence, gross incompetence, or there's a reason why we don't have it, and it's because there's interests at the table that do not want it. And by the way, those interests haven't gone away from the table. So, and that's one of the reasons why I think that this current little, basically the signaling that we're going to get Pharmacare, and it may very well be in the Liberal platform, but I wouldn't put money on it. And if anything, if it was me, what I'm thinking is that it will be set up, if they do win, they will go to the provinces who have, the majority of the provinces now have a Conservative premier, and they will make the promises deals that the provinces cannot accept. And then the Liberals will go back to the public and say, sorry, we wanted it, but the provinces weren't willing to pay, right? They weren't willing to do this for you hardworking Canadians. And they'll be off the hook again until the next government wants to win a re-election and decides to dig up the idea of Pharmacare. Now, many people seem to be unhappy with both of the main party choices. The good thing is that apparently, and you might not see this in news articles these days, but there's more than Conservative and Liberal options out there. And if you look at Vision Green is the Greens' defining document of what we want to see in order to make Canada more affordable for people, right? And make it a better place. And the Vision Green document is fantastic. The election platform has not come out yet, but in the meantime, you can go to greenparty.ca and look at the Vision Green document. And it will tell you that we intend to do Pharmacare, and this is not just for the election. The Greens seem to be a pretty ethical bunch, that just a bunch of do-gooders, right? But want to do it and make it financially affordable as well, and economically affordable for the country as well. So they want Pharmacare, but they don't want to stop there. They want to increase mental health care services, which is great, because how many people, you probably know somebody, or possibly you've been impacted by this yourself, where you cannot get in to see a psychiatrist. It may take 6 months to a year or more, or for your child to get in and see a psychiatrist if need be. Accessing psychologists. Right now, you had better have money or very good benefits, because otherwise they make it very, they charge a fair amount, which is appropriate to their education, but that puts them out of access and out of reach for most Canadians. Anyway, so Pharmacare, improved mental health services. They want to take a new approach to addiction, which is fantastic given the opioid crisis. And then basic dental. So do your research. I'm going to put up some links that provide more information about all the various iterations that commissions and reports have had over the years as they recommended Pharmacare, since basically we got publicly funded healthcare. Have a look at those. And you may want to, look at all the other issues, look at the parties, the various parties, look at, do they appear to be ethical? Do they appear to respect the rule of law? Do they appear to respect the people who vote them into the positions that they get? And with regards to Pharmacare, do you want the possibility that you might get Pharmacare, even though it appears to have been time to basically be a bit of electioneering and that's it? Or would you like to maybe get Pharmacare, basic dental, and a more fleshed out mental health plan with funding that will not cost you or me as a taxpayer more, because it's doable. I've kept this under to just over 10 minutes. I don't want to speak much more on it. If you have any comments, please let me know. I will address any questions or concerns as much as I can. But yeah, Pharmacare, it is a great idea. It was a great idea 40 plus years ago, and that hasn't changed. We just need a government that will act on it so that we can all have better health and our costs can drop and we can do better economically as a country. Thanks for listening. Have a good night.